In 2022, an ad hoc committee of the National Academies of Sciences, Engineering, and Medicine began a consensus study to explore the complex relationship between social media and adolescent mental and physical health, and pinpoint research that is needed to more fully understand the impact of social media products on different demographics of youth. While there are many positive aspects of social media, such as their ability to entertain and facilitate important connections, especially for those who may feel isolated, there are also potential negatives we must address as a society to protect our young people.
The committee did find that there are harms that emerge from social media. Those include a threat and the risk of harassment, the risks of people connecting with those who actually want to do them harm, and social media displacing, for example, time spent with friends, displacing time spent on homework, as well as social media then working to connect people to behaviors that are harmful for them. For example, disordered eating. For example, the use of substances.
So how do we maximize the good and minimize the bad? The study committee made specific recommendations in their 2023 report to help policymakers, regulators, industry, and others chart a course of action using the categories of design, training and education, online harassment, and research. Those recommendations included a diverse technical working group to develop standards for platform design, transparency, and data use that could form the basis for benchmarking social media companies' commitment to safety and openness.
It is really hard for adolescents and for parents to know which social media platforms are taking the necessary steps to make sure that we have a safe online environment. While we hope that the standards would lead to a virtuous cycle of social media platforms complying, if they do not do so, these standards would also create a pathway to make sure that they are held accountable.
User-friendly systems for reporting, follow-up, and adjudication of cases involving online harassment and abuse.
One of the reasons we need better reporting about online harassment is we need to understand it better as a phenomenon. So, for example, body shaming. Even if you were completely convinced this is a problem and you didn't need to know anything more, knowing how to fix the problem really depends on a better understanding of the mechanisms by which it happens.
Comprehensive digital media literacy education in K through 12 and training for teachers.
We as a country want young people to be educated about the use of social media. And to do it in the schools, you need to make sure that teachers are prepared to teach it. That is not so straightforward. So the committee tried to give some concrete suggestions about who that responsibility lies with so that this becomes part of curricular training.
A national research agenda that prioritizes the health impact of social media, the epidemiology of problematic use, the role of parents, algorithmic audits, and more.
Social media platforms are changing constantly over time. When they change their web interface or other components, that can break our ability to collect data. Social media platforms have a really tight control over their data, and they use both technical and legalistic strategies to do so. And we need more progress in this space.
Revised FTC regulations that clarify how to make reporting systems comply with COPPA and support and intervention products for youth who experience abuse.
COPPA prohibits the collection of any information of children under 13 without parental consent. This will come as no shock to anyone. Some children who are under 13 lie and get online. The companies who have approved mechanisms for determining the age of children say, we don't have a problem, there are no children online, when on some level we know that's not true. So we have a form of liability. These people who violate COPPA end up having to pay fines and having to bear public criticism as a result of this. Have an incentive to be less than forthcoming and can deliberately not collect information that may obscure our ability to understand what's really going on.
Better access to data for research, including a requirement for providers to remove prohibitions on researchers' use of public data from their terms of service, and relevant legislation to see this through.
In order to determine an effect of something, you want to say, let me see what you were like in 2019. then 2020, then 21, and track over time your social media use and track your health over time. We need quite a bit more research so that we can hone in on what are the elements of social media that may be most harmful or conversely more beneficial.
As the social media landscape continues to evolve, the need for a path forward to assess health effects is clear. Let's empower parents, teachers, physicians, and others to provide the right guidance at the right times.
Social media has transformed the way we interact, the way we communicate, and we think we know a lot of things, but we have to chop a little bit finer. If we were to enact laws that blanketly prohibited use of social media in a wide range of contexts, we actually risk doing more harm than good.
Our goal should be to understand the mechanisms through which the technology affects health so that we can encourage the positive and downplay, mitigate the negatives. And I think the report tries to provide a roadmap for that.
To learn more and access the full report, visit www.nationalacademies.org/social-media-adolescence.